Research has revealed with NP collaborative practice models, there's enhanced physician satisfaction with shared decision-making, responsibility and workload, and increased job satisfaction for healthcare providers with improved morale and teamwork.
I think one of the real benefits for myself and my family was the easy access to the service. One of the biggest things that I find is the ability to get in a timely fashion, to be able to phone and not have to wait weeks for an appointment. I'm able to get in right away. I'm very satisfied with the service that I've received from the NP.
The consistent care and just the fact that when my sister or myself see something that we want it to be dealt with very quickly, she's just a phone call away. We have her cell number. So to have the nurse practitioner's cell phone number to make her care or my mom's life, end of life care, amazing, is just, can't thank them enough. We need more.
I find my role with families is a lot of providing information. Communication is huge with families because a lot of times they're unsure about their family members' care. So I'm available to sit and meet with them, to go over their care plan, to kind of relieve any anxiety they have, to be sort of that go-between between the family and the staff, to sort of clarify what the family wants for care for their family member.
As a nurse practitioner working in cardiac surgery, I'm often the first face they see as I follow them through the continuum. After their surgery, I see them in ICU and start preparing them for discharge and seeing them on a daily basis as well.
Patients will love it because they're going to see the more continuity that they have day after day of care. And often you can use a nurse practitioner as well as a contact once the patient is discharged for follow-up or if there's any issue to overshoot. So I only see good things into that. So if I was to give advice to one of my colleagues that is thinking of potentially hiring NP or getting involved with the program, my advice would be to embrace it. It's only going to improve the quality of the program. It's going to provide him with more time to do more things that he couldn't do before.
The thing that struck me the most when I started working with an NP was just the sense of relief from shared responsibility. I felt like as a practitioner prior to working with an NP that I was very isolated, and almost lonely, working in a bit of a silo. I certainly had relationships and connections with other physicians and other care providers in the community, but not that kind of collaboration that exists in real time in working with an NP. I'm often asked by other physicians about the financial bottom line of having a nurse practitioner work in this primary care setting. And I would say that having a nurse practitioner in my practice has helped my bottom line.
Having a nurse practitioner in Pleasant Valley Manor, the extended care, has just made my sister and I's life amazing, just so much better. And then you can see it in our mother's care too, you know, she's basically symptom-free. So we're very, very, very pleased. Can't say enough about the nurse practitioner. She's been amazing.
It's very commonplace to go out there with either myself or my dad and to have a discussion, and then, you know, if there's any question whatsoever, the doctor is always called into the conversation. So I have the best of both worlds. I am able to get an appointment in a very timely fashion. I'm able to sit down and have a long discussion if I feel like having it with the nurse practitioner. And then if the doctor is needed, the doctor is right next door and comes into the room to be part of it. So very fortunate to have that.